first start off with my disclosures. I'm a consultant for OpMed, Excelity. Dupuytren's is one of my favorite procedures to do, and the other one is that I actually have Dupuytren's. So where's Harita? Harita, so I will do your ulnar release if you fix my Dupuytren's. Okay. We'll just do the background, anatomy, pathophysiology, diagnosis, and treatment. And so what is Dupuytren's disease? It's progressive fibromatosis of the palmar and digital fascia. It's really interesting. The history, 1614, Felix Platter reported a case, Henry Klein, Sir Ashley Cooper described the treatment with a closed fasciotomy, but we all want to hear about this guy, Marilyn Guillerme Dupuytren's, 1831, gave a detailed anatomic description. He talked about the exaggerated tension, and he did the first successful open fasciotomy. But it's really even more interesting than that. So this guy, Guillerme Dupuytren, first of all, he's got strike one, he's French. Strike two, he's practicing as the chief surgeon of the Hotel Dieu during the Napoleonic Wars and the French, right after the French Revolution. And he is known for being the biggest jerk on the planet. He's known as the Beast of the Seine. He's mentioned in a whole bunch of literature, because he's the most famous surgeon at the time, and everybody was writing, and he's mentioned in Les Mis just because he's having a fight with somebody else, like a fist fight at a play. They describe him as first among surgeons, least among men, is the way he is described. So he's known as like the meanest, baddest guy on the planet. There's actually another famous story. He was the actual personal surgeon to Louis the 13th. Louis the 18th. And he gets up there, and then the first time he's treating him, he, in a very formal ceremony, the king says, "I'm going to give you this as for treating me and being such a brilliant surgeon." And he's giving him a purse. And he's like, "I'm not going to take that purse. You have to. I'm this famous surgeon. I'm so great. You have to pay me with money. This is ridiculous." So he opens it up and he takes out all of these gems which he had in the purse, put in like a few dollars, and gave him the purse. So he's known as being not a nice person. But Dupuytren's is also really interesting, known as Viking's disease. Famous people who've had it. Ronald Reagan had it, was operated on. Margaret Thatcher also had it. You guys know Bill Nighy, the famous actor, British, has it really bad. If you ever look at pictures of him, these two fingers are kind of pulled down. And Samuel Beckett also had it. So it's very, very common, especially in Northern Europeans. And it's called Viking's disease, Celtic hand, the curse of the McCrimmons. Don't know who they are, but obviously that's a little indication that this is genetic. And the hand of benediction. Anybody, Christians, Catholics in the room? The papal blessing, a hand of Sabbatios. Sabbatios. And if you look, the papal blessing is exactly like somebody who has Dupuytren's. And the theory was that at some point in history, if they talk about it, that the papal blessing goes all the way back to St. Peter. So St. Peter, the first pope, started with the first blessing, and he may have had Dupuytren's because the hand is stuck in that particular orientation. There's also the hand of Sabbatios, and that is what looks exactly like a Dupuytren's hand. They also think that this was a pagan idol, and it's basically the hand of somebody who has Dupuytren's. And they thought that maybe early on, at the same time that Christianity was starting, this was also very, very popular in the Roman Empire. And maybe the early popes started doing that because they were trying to incorporate as many of the pagan rituals as possible into early Christianity. But it's got a pretty high global prevalence, 3% to 6% among adult Caucasians. It's really all races, but rare in people from African and Chinese descent. It peaks in your 40s and 50s and rises with increase of age, and it's more common in men. And they talk about it being, it's very genetic. They talk about it being the disease of the Celtic race. It's autosomal dominant with variable penetrance and other contributory factors. Now, what they mean by variable penetrance. So it is autosomal dominant. So that means that I had to get it from either my mom or my dad, and neither one of them has it. So that means that if you have it, you don't always get it, even if you have the gene for it. Associated condition: diabetes, alcoholism, seizure, smoking, hypercholesterolemia, HIV, vibratory work. And they used to think that it was maybe has to do with having some kind of trauma to your hand. The only thing I can tell you is it didn't happen until Tommaso Madonna signed me up for CrossFit as a gift. I was perfectly fine. So I'm actually going to write a paper on this CrossFit-associated diseases, because there's a lot of them. Mostly it's people leaving in an ambulance, but this is something that's a little less traumatic. So basically it starts out as a nodule, then it forms a cord, and then pretty soon your fingers are stuck in. And you can see it really affects the little finger, ring finger mainly, which is where we get the papal blessing from. But it can affect the middle index and thumb rarely. There's also, what's interesting is this is the your palmar fascia and your plantar fascia. And these are very, very specialized. And I'll get to that in a second. But if you have it on your knuckle pads, it's known as Garrett's disease, Lederhoden disease on your foot, and if it's in your groin, it's a Peyronie's disease. And there's a severe familial form, which earlier onset, higher incidence, and increased recurrence. Roger, have you ever seen one of these genetic? I've only seen, so I've never seen the familial form. I don't know if Brian or...
I've seen it in families.
Really?
Yeah.